Hi Cal, how are you today?
Good.
Good. My name is Claire and I am the SLP here on your care team. And today I am going to be doing a cranial nerve assessment with you. We're going to be checking out those cranial nerves after your injury just to make sure that everything is functioning the way that it's supposed to and there's no residual issues after that head injury you had. So to check these cranial nerves, we're going to be looking at different sensory and motor aspects that your body exhibits. So things like your sense of taste, sense of smell, sense of hearing, vision, stuff like that for sensory. And then for the motor aspects, that's going to be more like your muscle movements and things that are associated with those nerves. So how we speak, swallow, and move our shoulders, things like that. Today, is it all right if I do that assessment with you today?
Yes.
Right, and when I do that, I'm gonna have to get a little bit up close and personal and touch you, but is that all right as well?
Yes.
Okay. Well, I'm gonna really quickly put on some hand sanitizer and some gloves. And while I do that, would you mind just putting your feet on the ground for me and sitting up straight? I just want to observe you and make sure that you don't have any noticeable differences on either side of your face or anything. Are you exhibiting any sort of pain or anything like that today?
No.
Alrighty. Well, we can start then with our first nerve, which is going to be our optic nerve, our first cranial nerve, and that is our olfactory, so that's going to be a sensory nerve, and how we check this is to check your sense of smell. So I'm going to have you close your eyes today, and I'm going to have you smell something in a cup, and I just want you to tell me what that smell is.
Okay. What?
So I'll have you close your eyes, and I have you smell for me, okay? Alrighty. And what was in that cup?
Coffee.
Yeah, perfect. That one's pretty easy to do. So, and is there ever a time where you feel like you can smell better out of one side or the other?
No.
And the next nerve is going to be our second cranial nerve, and it's again another sensory nerve. And it's going to be checking your visual acuity, your visual field, and your pupil response. That's pretty much a fancy way of saying we're just making sure that your vision hasn't changed much since this. So I'm going to start by having you focus on my nose. And I'm going to hold up some numbers out here in this visual field, and I just would like you to tell me what those numbers I'm holding up are, okay?
Okay.
So I'm going to start up here.
3, 4, 5, 2, 3, 5.
All right, perfect. And now I'm going to check your peripheral vision. So I'm going to come and step behind you, and I'm going to have you tell me when you can see the tip of this pen, this in your eye vision, okay?
Okay. Now. Now. And now.
Alrighty. Doing great so far. So the last thing I'm going to do is look at your pupil response. And so unfortunately that means I have to shine this light in your eye, so I apologize.
Okay.
But I'm going to do it once in either eye and kind of from an angle as well, okay? So looking at this, we just like to make sure that those pupils are reacting correctly to light. Just like with the other ones, we're just checking that visual field and acuity to make sure that it hasn't changed. And it looks like everything is going the way that it should. So now we've looked at some sensory aspects of those first two nerves. We're going to move on to the third, fourth, and sixth cranial nerve, which are going to be more motor aspects that are involved with our eyes. So the first one we're going to do is the third cranial nerve, or the ocular motor. So we have a lot of different muscles that help us move our eyes, and this is going to be one of the tests that we do to make sure that those are working correctly. So first I'm just going to check and make sure your gaze looks proper, just looking at me, and then I'm going to have you follow my pen with your eyes, okay?
Mm-hmm.
Right, that looks really good. So now we're going to move on from the ocular motor to the trochlear, which is again just talking about some of these little muscles in our eyes that help us move and make sure we can see everything. So this one I'm going to have you go a little cross-eyed for me, and I'm going to have you focus on my pen, and I'm just going to go forward, and then I'm going to come down just a little bit. It looks like those muscles are working just great. So we have that. And then another thing that I'd like to look at today is going to be involved with your sixth cranial nerve, which is called your abducens cranial nerve. And previously, we've just been looking at how those muscles are working. I'm checking either side, making sure everything's good. But now I want to look at the coordinated movements of both of your eyes, make sure everything's moving smoothly.
Okay.
So I'd like you to follow my pen. Looks really smooth. Both eyes are following my pen perfectly. Alrighty. And do you have ever any double vision or any issues like that?
No.
Alright, good. Well, now we'll go backwards a little bit, back to that fifth cranial nerve, which is our trigeminal nerve. And this is one of the first ones that has both sensory and motor aspects to it. So to start, we're going to look at the sensory portion of it, and I'm going to take this Q-tip, and I'm going to lightly touch your face with it. And I just want you to let me know that you're feeling that sensation when I'm touching it, okay?
Okay. Yeah. Feel it. And feel that.
Perfect.
Okay. Okay. Okay.
Nice. There's just different parts of our face that have different senses, and we just like to make sure that all of those areas are functioning. And now I'm going to have you open your mouth for me, and when I do this, I'm going to try and push it close, and I'd like you to try and keep it close for me. And then when we're done with that, I'm going to do the same thing, but from either side, so that I can just get a little bit of feel for your muscles and how they're working.
Keep it still.
Yes, please. Yeah. And this is looking at that muscle aspect now. So I'll have you open your mouth. Good. And now I'm going to try to have you open it again. Try to move in one direction and the other. All right. Everything is looking great so far. And then would you just go and move your jaw from side to side for me? Now we are going to move on to the seventh, because we went through the sixth there, the abducens with those eye movements. So we're going to go on to the facial nerve, which again has both sensory and motor aspects that we're going to look at. The first is going to be the motor aspects. So I'm going to have you make some faces at me. First, I'd like you to give me a big smile, and now a big frown. Alrighty, and then I'd like you to raise your eyebrows and kind of just grimace at me. Perfect. And then can you puff up your cheeks with air? Perfect. I'm gonna make sure that's a good seal there. Alright. And now I have a couple of things over here to test your sense of taste. That there's a portion of this nerve that is associated with that. And so I'm gonna have this one, and I'd like you to just open your mouth, and I'm gonna place it on your tongue, and I'd like you to tell me what you taste.
Sugar.
Alright. And what about now?
Salt.
Perfect. So we have all of those muscle functions intact, and that's salt and sugar. Everything's looking great. So now we're moving on to the eighth cranial nerve, which is going to be the vestibular cochlear nerve. So that's a fancy way of saying your sense of balance and your sense of hearing. So the first thing what we're going to do is we're going to test your sense of hearing. So I have this tuning fork here, and I am going to hold it behind you, and I just like you to tell me that you're hearing it when I hold it near your ear, okay?
Okay.
Right.
Okay. Okay.
And one more here.
Yep.
And when I was doing that, was there a point in time where you heard it better in one ear than the other?
No.
Okay. And then the last test I'm going to do is I'm just going to rub my fingers near your ear, and I just want you to tell me that you're hearing.
Yes. Yes.
All right. Now we are going to move on to the 9th and the 10th cranial nerves, which are going to be the glossopharyngeal and vagus nerves. These both have a small sensory aspect, which is involved with swallowing, but most of it is going to be more of a motor aspect. So to check this out today, I'm going to have you first just give me a good cough. Alrighty. And after that, I want to grab my flashlight again, and I'm going to have you open your mouth for me. And I would like you to go, ah.
Ah.
Right, everything's looking great with that. And then would you mind taking a sip of water with me with that? That's one of the ones that we look at with the sensory aspect of these, with the glossopharyngeal. And does it feel abnormal swallowing at all since your injury?
No.
Alright, have you had any issues with your gag reflex?
No.
Okay. Well then we can move on from the 9th and the 10th nerve and go on to our 11th cranial nerve, which is going to be the accessory, a spinal accessory nerve. And this one is easy to test. It's just motor aspects. So the first thing I'm going to have you do is I'm going to have you raise your shoulders. And I'm going to try and push them down. Good. And now I'd like you to just turn your head from side to side. Right? And I'll have you do it again, but I'm going to have you try and turn it while I'm holding it. Alright, now on the other side. Everything is looking great. And I was supposed to have you walk across the room when I was looking at your vestibulocochlear nerve. I need to look at your gait and make sure you're walking fine. So I'm going to have you do that for me now.
Okay.
Would you just mind walking to the end of the room over here and back? Everything's looking great, thank you. Have you noticed any favoring any side when you're walking?
No.
And now we are on our last cranial nerve, and this one again is going to have just motor aspects, and they're involved with your tongue. And so the easiest way for me to look at this is to have you just stick your tongue out for me, and just have you open your mouth all the way. I'm just looking for any side protruding either way or anything. And now I'd like you to move your tongue from side to side while it's out like that. And have you noticed your tongue being uneven or anything since your injury?
No.
Perfect. Well, it looks like everything is you're doing great, and there's no residual effects from what I can see. I'm gonna get this information to your your doctor and your the parts of your care team. And it was really nice to meet you today.
Thank you.
Thank you.